Let's now talk about the other end of the spectrum with the central nervous system drugs, and these are the stimulants. Take a few minutes to briefly review the CNS and how it works. The central nervous system is complex. Remember, you have this system that's regulated by checks and balances or negative feedback systems. And in this case, it's the negative feedback systems of the excitatory and inhibitory neurotransmitters that act on the receptor sites in the brain and the spinal cord tissues. Central nervous system stimulation will result from excessive stimulation of the excitatory neurons or from a blockade of the inhibitory neurotransmitters. CNS stimulants is a broad class of drugs. They are drugs that stimulate a specific area of the brain or the spinal cord, and most of them work by stimulating the excitatory neurons. These excitatory neurons have receptors for excitatory neurotransmitters, such as acetylcholine and epinephrine, dopamine. Dopamine is unique in that it can be both excitatory and inhibitory. But because these drugs mimic the actions of the endogenous catecholamines of the sympathetic nervous system, you will hear them referred to as sympathomimetic drugs. Drugs are classified in three ways. They can be classified by chemical structural similarities, site therapeutic action in the central nervous system, or by their major therapeutic uses, such as attention deficit disorder, narcolepsy, obesity, etc. This is the most common way that you're going to see them classified, is by the major therapeutic uses. You can see more detail of these classifications in tables 13.1, 13.2, and 13.3 of your textbook. So we're going to start with the drugs for ADHD and narcolepsy. And we won't go into detail about what ADHD is, but I just want you to know that ADHD is a condition that's commonly diagnosed in today's children. Hallmark symptoms of this disorder include hyperactivity, impulsivity, and inattention. It's more common in boys than in girls, with a ratio ranging from about 4 to 1. And research is showing that ADHD also affects adults, estimates ranging between 2 and 7% of the population. Growing evidence supports the idea that ADHD is somehow genetic or somewhat genetic, and it's associated with the dopamine transporter gene and the dopamine D4 gene. When you don't have those genetic components, it can be neurobiological. Things such as perinatal stress, low birth weight, traumatic brain injury, maternal smoking during pregnancy, or early infant deprivation. So in ADHD, a stimulant is usually the first line of medication, and there's about 60 years of research on these drugs, particularly Ritalin. So you'll see on your list amphetamine and methylphenidate. Those are stimulants. Dexedrine, Adderall, or amphetamine. Concerta, Ritalin, Metadate, CD, those are methylphenidate. A really important thing to monitor in these patients is weight loss. And then we come to Strattera. Strattera is actually not a central nervous system stimulant. And because it is not a stimulant, it is not a controlled substance. There's really no potential for abuse or diversion of this, whereas the stimulants like your amphetamine and methylphenidate have a really high propensity for addiction as well as for substance abuse. Now, although Strattera is not a stimulant, we have put it into this classification because it is where we are classifying by major therapeutic use. And atomoxetine, which is Strattera, we said is not addictive, but the way it works is it inhibits the reuptake of norepinephrine by inhibiting the presynaptic norepinephrine transporter. It actually has a very short half-life in normal metabolizers, but an extended half-life in poor metabolizers. The newest on the market is the Vyvanse lisdexamfetamine, and it is interesting. It is a stimulant, and it is a prodrug for dextroamphetamine. So with Vyvanse, we have to be sure that the person is aware that they cannot take an antidepressant that's called a monoamine oxidase inhibitor, or an MAOI, within the last 14 days. If they have had an MAOI in the last 14 days, then what can happen is they can have an hypertensive crisis, which can lead to stroke or other permanent injury. So then we have the stimulants used for narcolepsy. These are modafinil and armodafinil. These trade names are Provigil and Nuvigil. Narcolepsy is a sleep disorder, and it's caused by malfunction in the primary brain mechanism that induces sleep. So individuals with narcolepsy actually achieve REM sleep. We talked about REM in our CNS depressant discussion. And so they reach this REM sleep in literally less than a minute. They bypass all of the other sleep stages. So they have excessive daytime sleepiness or somnolence. And then they can have sleep paralysis and a thing called cataplexy. This is where they have these attacks of muscle weakness. They also can have hypnagogic hallucinations. And these hallucinations are usually not the first manifestation of narcolepsy, but the cataplexy can actually occur as the first symptom and can be sometimes identified in children. Cataplexy attacks are usually precipitated by a highly specific situation or strong emotion, so things that trigger them, and their muscles will just go limp. Since there's no cure for narcolepsy, just like there's no cure for ADHD, pharmacologic therapy is initiated, and what we used to use for this was the amphetamines and the methylphenidate, Ritalin. But now we have the Provigil and the Nuvigil. They are non-amphetamine, and they're classified as Scheduled 4 controlled substance. So these drugs are actually what we call psychostimulants, and they have very unique properties to promote this being awake, this wakefulness. The potential for abuse is much lower in these, but we still do need to monitor them. The way that they work, we're not really sure, but it appears that they attenuate the central alpha-1 adrenergic system. And the primary site of action are those subregions of the hippocampus and the central-lateral nucleus of the thalamus, along with the central nucleus of the amygdala. So they can produce euphoria and some psychoactive effects similar to the other CNS stimulants. So we want to be careful and cautious with those. So these ADHD and narcoleptic drugs all work by stimulating areas of the brain associated with alertness. And this is like the cerebral cortex, like we said, the thalamus and the areas of the amygdala. So remember that CNS stimulants actions are those of the sympathetic nervous system. So when we think of sympathetic nervous system, remember sympathetic nervous system, S, stress, fight or flight, parasympathetic, P, peace, feed or breed. So these drugs stimulate, and they cause this sympathetic response with our cardiovascular system and a respiratory system being affected. You see mood elevation or euphoria, but what happens is you get this increased mental alertness and a capacity to focus and work. There's a decrease in the fatigue and drowsiness, and so the patient has prolonged wakefulness or prolonged attention. Because of the action, remember they have respiratory effects. So it's going to be similar to that fight or flight. You're going to have a relaxation of the bronchial smooth muscle, increased respiration, and dilation of the pulmonary arteries. So our adverse effects are actually pretty wide-ranged, and they're dose-related. They tend to speed up the body system. So the common adverse effects are things like palpitations, tachycardia, hypertension, etc. So contraindications for these drugs, other than the obvious allergy, would be, let's think about that for a minute. I'm sure you came up with cardiac issues, right? Cardiac problems, cardiac structural abnormalities, anxiety. Also, anxiety, glaucoma, and Tourette's syndrome can actually be aggravated or exacerbated by these drugs. And again, they should not be taken by those who are taking MAOI MAOIs or monoamine oxidase inhibitors in the last 14 days. Next, let's talk about the anorexians. These are medications that are used to treat obesity. You'll hear these drugs as benzamphetamine, methamphetamine, phentermine, Didrax, Desonex, Desoxin, Ionomin. Now, orlistat, we put in this anorexiant category. However, it is not a CNS stimulant, just like our Strattera wasn't in the other ADHD medications. So orlistat is actually a lipase inhibitor, not a CNS stimulant. It's used to treat obesity. One of the big things about orlistat, and the reason we don't like to use it, is because it is it can cause fecal incontinence, and patients rather have a difficult time with that particular side effect. So you'll notice the others end in what suffix? Phetamine, right? So these are controlled substances. And an important part of monitoring this that you may be asked to do as a nurse is getting weight checks for the patient, because if the patient isn't getting benefit from this medication, then continued use of the controlled substance is not good. It can lead to abuse of the medication. How do these medications work? Well, they suppress the appetite control center in the brain. They increase the body's basal metabolic rate. This causes mobilization of the adipose tissue stores and enhanced cellular glucose uptake. Now, there is the orlistat, which reduces dietary fat absorption. Contraindications for these include, obviously, allergies, but cardiovascular disease, hypertension, thyroid disease, glaucoma, mental agitation, and any history of substance abuse or an eating disorder. We should not be giving these medications to those patients. These medications, because they are stimulants other than the orlistat, should not be used with an MAOI, or if they've had an MAO in the prior 2 weeks. The orlistat is contraindicated when there's a history of any malabsorption syndrome. Adverse effects of these drugs include possible elevated blood pressure and heart palpitations, anxiety, agitation, dizziness, and headache. So these heart palpitations can lead to dysrhythmias, and that elevated blood pressure can occur with these medications alone, but the risk is greatly increased with use of the MAOIs in the prior 2 weeks. So we're going to take a quick break, and I'm going to divide this lecture up. We have about 14 more slides. See you in a few minutes.